Hi everyone, good morning. My name is Shazia Khan, and today's session we're doing is Learning Outcome 2, and the unit we're doing is Principles and Values and Regulations in Health and Social Care. And the Learning Outcome 2 we're doing is to understand legislation and guidance which impact on the provision and practice of health and social care. So we looked at learning outcome in the last learning outcome 1 in the last session, and we looked at understanding the current the policy frameworks and procedures and elements of that. So we looked at identifying the different types of uh, current policies on health and social care. I'll just give you a summary of what we did in the last session. So we looked at identifying current government policies relating to health and social care, and we looked at the impact of the policy on health and social care sector, and also the provision of care within the chosen area. We looked at how policy meets the current needs of the population in health and social care. Um, and policies and procedures and how they are split into 4 groups. So administration, health and safety, human resource and service delivery. And we looked at the different elements of the different external bodies that they worked with. So NHS, medicines and healthcare regulatory agencies. So that was something we looked at in learning outcome learning outcome 1. The next learning outcome we're looking at is learning outcome 2, which is to understand legislation. So when we look at legislation, why is legislation so important? Why do you think legislation is so important?
Hmm.
Do you think there's a need to have legislation?
Yes,
Why? Do you think it protects people?
yes,
Yeah.
it protects our boundary.
Yes. It protects you as an individual, but also protects
The
different
boundary.
boundaries as well, what you can and can't do. And that's really important, to
Yes.
identify that. So the learner in this will understand legislation and guidance which impact on health and social care. And the learner can look at 2.1, which is to outline sources and status of legislation, regulation, and guidance in your chosen area. 2.2 to analyse the impacts of legislation and guidance on the provision of health and social care provision. 2M1 to look at the aims and purpose of legislation and guidance. And then 2 to assess the implications of failure to comply. So if you don't comply with it, what are the complications in that? So 2.1, there are many examples of legislation, guidance, and for social and healthcare, and we'll go through each one. These are some examples, but I feel like it's better if you go through each one so you have a little bit of an idea of what we're going through, okay? So the element of having looking at legislation when it comes to the health and social care, the first one is the Care Act 2014, and this was an act that was reformed adult social care in England. So the whole aim of this act was to improve well-being and independence of individuals who need care and support. So it outlined the responsibility of local authorities in providing um, care and support and well-being. And the act was introduced because there was a need for the act. Remember, the legislation, the laws are not introduced because they want to be introduced. Is there a need for these laws to be introduced? If something's not going right, would a law be introduced?
Yes.
Yes. Why? To improve that.
Mm,
Yes, to make it better, isn't it? To make it better and improve it.
yes.
Um, so the next one is the Health Mental Act 1948, the Public Health Act, and this act was responsible for advising people on public health matters such as epidemics and disease prevention, and this was in 1848, so it's quite a historical act. The next one is the Mental Health Act, and this outlines people mental health disorders and treated and how they should be treated, what their rights are, what their affairs are, because they don't, mental health these people sometimes will have a disorder, they won't understand anything. Then you've got the Human Rights Act again, is protects everyone's human right. You do have human rights yourself, and it protects them. Equality Act to do with discrimination. Anyone that is discriminated against based on age, gender, your sex, anything would be put into the Equality Act. And health and safety protection. Why do you think health and safety is so important within health and social care? Are you using equipment that's, requires health and safety provisions?
Yes, like medication.
Yeah. So, that's really important. And data protection. Again, data
Yes,
protection is really important. GDPR, protecting individuals' data.
yes, yes.
So the next one we're looking at is outlining sources, and we're looking at guidance. Guidance is you get guidance from healthcare professionals, and they have ethical codes that they must follow. The professional bodies, they have to conduct themselves in a certain way, so they have ethical codes and professional standards they must follow. And certain ones are part of the GMC, which is the good medical practice, and they have expectations that you follow them. Why do they have expectations that you follow this guidance? Why do you need to make sure that you are following this guidance and ethical codes and professional standards?
Um, I would say to provide good services.
Yes, yes. To make sure that, the services are offered that, are in line with the standards and the, correct procedures. So, ethic guidance is really important from ethical and professional standards. Then you have the application of legislation. Hmm. And that is allows government departments to put policies in place and things. And the World Health Organization is the first one that deals with it. And the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. So is emphasizes that health is more important than just the absence of illnesses. So it refers to diseases, infirmity, proper functioning of the body, So the definition under the World Health Organization constitutes that people have the highest level of health. So it's really important. Then we have the aims and purpose of legislation, regulation, and guidance, why it's so important. Now, within health and social care, the aim is to protect individuals, so protect the individuals and protect them and ensure a high standard of care is provided. Legislation provides the framework that you have equal access to the provision, so everyone has equal access, and there will be no penalty. There will be also penalties and fines if anything does happen. So you need to make sure that legislation, you are following the legislation, you are following the laws in place. Why is it so important to follow the laws? Why do you think it's so important to follow the laws?
Right. Guide us.
Sorry?
I said it guides and it's
Yes.
to protect the service user.
Yeah. And the country is has the laws in place to protect individuals, doesn't it? And yourselves. So
Yes.
you need to make sure you're following the law. If you breach the law, there are consequences which we'll look at later on in the slides.
Mm.
So outline sources of guidance. We have government legislation. Government legislation is laws that are enacted by governing like parliament or legislation. All the laws are passed through parliament. So they are the governing government legislation. Then we have professional bodies like GMC and CQS. GMC is the General Medical Council, and the GQC is the Care Quality Commission, and they are they're interconnected organizations that play a crucial role within health and social care. The GMC regulates doctors, ensuring that they meet standards and conducts and performance. And the CQC regulates health and social care services, inspecting the rating provided by hospitals and care homes and ensure the quality of life. So there's a need for both of them, there's a need to make sure that, hospitals are regulated properly. Um, if a hospital is not regulated properly, what can they do? What can the CQC do? The Care Quality Commission. What do you think if they're not regulated properly, what can they do? Can they shut down a hospital?
Uh,
Yeah, they can close down the services, they can issue notices, they can issue fines. So,
mm,
they really need to be on top of things because some hospitals are not.
okay.
So they can, they have that power. And the reason they do that is if something's not followed. Do you understand? They won't just do that. But if
Mm,
something's not they're meeting the standards, then they will do that. You've got the clinical bodies like the National Institute of Health and Care Excellence, NICE, and which is an independent body in the UK that provides national guidance advice on how to improve your health and social care. And there are guidance and it helps you as an individual to follow that. Then you have the British Medical Association, and there is a trade union. It's called BMA, and they're a trade union and professional body for doctors and medical students in the UK. And they represent advocates for their interests and negotiates on behalf and campaigns for improvements in health care and medical profession. So, they are a trade union for doctors and medical students. Has anyone got any questions? Miracle, Catherine, Deborah?
no.
Excellent. Just ask away if you have any, okay?
Okay.
And then we've got 2.2, analyze the impacts of legislation and guidance on provision of health and social care provision on health and social care workers. So what is an analysis? An analysis is a detailed examination of elements, or like something in small parts in order to gain a better understanding. So you're analyzing it. It may be your own thoughts. It may be analyzing what is expected of you. So an analysis is trying to look at an examination. Then you have the impact of provision and workers, provision and workers within health and social care. So what do you think the impact of legislation is important for workers? Why do you think it's so important for workers as well? Not just for the patients, but why is it so important for workers? You're a worker, you work in the hospital. Would you expect the health and safety is a priority for you?
Yes.
Yeah, would the whole point of maintaining safety and quality of provision is that, it's there to improve quality and safety of services, and also, any sort of risk from harm, any health and safety issues. They need to make sure that they are promoting this, this health and safety for workers as well. Workers are the ones that are doing everything. So if there's no health and safety in place for them, then there's no point of you having health and safety in place. So you need to make sure there's health and safety in place for the workers as well, maintaining this, safety and quality of provision. You have to maintain uh, you have to put policies in place, don't you, in any organization? Maybe health and safety policies to make sure that you have a safe environment and an organization, and you, as an organization, have a legal duty to protect your employees. You need to comply with health and safety regulations. You need to protect them. You need to do risk assessments. Do you need to train people as well?
Yes.
Train them on health and safety procedures, yes. And what if an accident happens? What should you do as a worker?
You report-
Should you report it?
Yes.
Yes. You should report it. You should have emergency services in place, and risk assessments need to be done.
Mm.
And this is all to reduce any sort of injuries and legal costs as well. And you need to, as an organization, prioritize the health, safety, and well-being of your staff.
Mm.
Some organizations still are a bit incompetent with doing that.
Mm-hmm.
They don't fully do it to the full extent. That's why they get fined.
Yes.
The HSE come in and they fine you, the health and safety executive. If they see something is not being addressed properly, they will fine the people. Ensuring consistency, so making sure that everything is consistent on a day-to-day life, making sure that, in different aspects of life, there's delivery is effective and equitable, and that includes delivery of data management and adhering to the standards and making sure that there's no problems, and making sure that, everything is consistent. So, here we've got the healthcare professionals in regard to practical aspects such as record keeping. Now, again, we could talk about record keeping. Why is it so important? Why do you think record keeping is so important? Anyone, why do you think you have a duty as a care professional, sorry, to keep everything up to date, all the policies, everything. Records must be accurate. Why must you have everything up to date and keep all records? Are you complying with legislation?
Yes.
Yes. Catherine, why do you think it's so important to keep everything up to date?
Yeah, because apart from saving, helping, apart from it being beneficial to the service user, it's
Yeah,
also very important for you in case of an accident or anything. If
yes.
you keep a well-detailed record of
Yes.
everything that has been happening, I think it will protect you
Yes, yes, it will
as
protect you.
well.
Excellent. It will, effective record keeping is crucial for any sort of legal compliance, if there's any sort of accountability or efficiency, so it identifies, it involves having clear policies, maintaining up-to-date records, and ensuring proper storage of these records, because you've got to look at GDPR as well, making sure records are up to date, making sure patient records are up to date, so they are not, there's no cases for any sort of elements saying that you don't have any records up to date. So, you need to make sure that your records are up to date and they're accurate, they're legible, and they're, clear. Because, if someone needs the record at one time, you should be able to provide them that record. And for any organization, be it the hospital, mainly the hospital, because it looks at patient documentation, it needs to be organized and it needs to be managed and effective so that anyone coming in can, understand what's going on and, they've done everything, and it is an integral part of health and social care work. And it is about writing down everything you've done, everything you've observed, and what will happen next. Because, if something comes and there's a case and you've not followed legislation and you've not documented everything, you could fall back and, lose your job if it wasn't your fault. So you have to keep on top of everything. 2M1, analyze the aims and purpose of legislation. So why is legislation so important? Why do we need to have legislation in place? Why do you think it's so important? Why do you think? I'll ask each person so they have an understanding. So, Deborah, why do you think it's so important, legislation?
To protect our boundary as a health worker.
Excellent. Ibhadi, why do you think it's so important?
Record keeping.
No,
It's
aims, legislation and guidance. Why do you think it's so important?
It guides us on how to carry out our tasks effectively so we don't get into trouble.
Yes. Next one, who else have we got on here? We've got Ibadi, Catherine.
because it protects us and the service users as well.
Protects us and service users. Miracle?
It protects vulnerable individuals as well, and
Yes.
then sets clear standards.
Yes, it sets things. Yeah, so you're all on literally the same line. Legislation is a law created by Parliament, and it's binding rules that we must follow. Okay, and they govern like our society and our behavior, ensuring that we are protecting rights and promoting some sort of justice. And it is guidance, and it is there to, protect, safeguard citizens or from any sort of harm, exploitation, and unfair practices, and it promotes equal treatment and access to services. It provides this stable framework. So if we go out and we think that, we could do something, but the laws are preventing us from doing it, we know that it's working then, isn't it? So for example, if you're driving and you have a mobile phone, you know it's wrong, don't you, in your hand whilst you're driving. So it prevents you from doing something, but it also, it's the guidance and navigates effectively. The whole purpose is that it makes sure that you are following the laws, you are ensuring there's fairer practices and maintaining order and protecting rights and freedoms. So, it's there to protect us as well as individuals. We have the Department of Health, and they are there to improve and protect the health and well-being of the population. And this is achieved through like means including setting national policies, providing guidance, overseeing the health and social care system of the UK. And the department aims to enable people and individuals to live more independently and healthier lives for longer. The next one is the main aims of legislation guidance to reduce inequalities, to ensure and promote fairness and consistency, to protect the public and guide behaviour, and to establish a legal framework. Now, if you're at work and there's a laws in place, would you follow them? Do you think it's important to have policies and guidance and codes of conduct and legislation in place? Would you follow them if you know they're in place, that you should do something like this and do it like this, would you follow them? Deborah,
Yes.
Yes.
Sorry.
do you follow policies in place?
Yes.
Good. And sometimes, we think we don't need to follow them. We could do something without that, but it's things like, I'll give you an example, manual handling. You have policies in place for manual handling. Why is that important?
So that there won't be any accidents.
There won't be any accidents. You're lifting people up properly. You're bending down properly to lift things up, because to prevent accidents, health and safety is one of the most important things within health and social care. Why do you think health and safety is so important within health and social care? Do you think there's lots of accidents that happen? Remember, in health and social care, we don't just have, equipment. We have, what else do we have? We have medication.
Education.
Yeah, and why do you think that's important when it comes to health and safety? Why do you think it's important when we talk about medication and health and safety? We're giving the right medication to the individual.
To give the right medication
Yeah,
at the right time.
yeah. And also, we're promoting this public safety and welfare. So legislation is really important because it provides this foundational structure for society for defining any sort of rights and responsibilities. And laws are there to protect individuals and communities and from, ensuring public safety and well-being. And laws govern sectors, be it the health sector, be it social sector, any sector, and it looks at preventing any sort of abuse of power. What is abuse of power? What do you think abuse of power is? Abuse of power. Could people abuse their power? If you're,
Use of
sorry,
sorry.
no, it's okay. Carry on. What's abuse of power?
Abuse of power is when you go beyond what laid down rules that have been set for you.
Yes.
Yes.
So if you're a manager and I'm just a care assistant, the manager will sometimes abuse their power and deal with me differently because they have a hierarchy, don't they? They think they have power over it. So that's abusing their power. But the whole purpose of legislation and guidance is to support people, to ensure that there's order in place and ensure that there's, fairness within a society and protecting individuals' rights. So it's really important. Next one is 2D1, assess the implications of failure to comply with legislation. Now, if you, I'm not going to go through anything in a little bit. I just want to know from your perspective, what would happen if you didn't comply with legislation?
If you don't comply with legislation, you could get into trouble and legal action can be taken against you.
Yes, excellent.
Sorry.
Legal action can be taken against you. Can you get fined?
Yes.
Yes.
Also dismissed.
Yes, or dismissed. So failure to comply with any sort of legislation or any guidance can have severe consequences, including financial penalties. It could be legal repercussions, your reputation, or in some cases, even imprisonment if if it's quite serious.
Mm.
So you need to make sure you are complying with that. Why is the next looking at that, why is health and safety compliance so important? And we talked a little bit about that. Health and safety is crucial for any organization, be it a business or a hospital or anyone, because you need to protect employees and you need to comply with legal requirements, ensuring efficiency and reputation and prioritizing health and safety. It can reduce accidents, it can reduce costs, and it fosters this positive working environment. So improving things and making sure you are complying with health and safety regulations such as risk assessment, safety training, providing safety equipment. What is give me an example of something that's a safety equipment or safety, clothing or anything. Give me an example of that in health and social care. What can be a safety equipment that you have to wear?
Apron.
Aprons. What else?
Your
Glove.
glove,
Gloves,
Mask.
masks. Yes, these are all health and safety equipment that you have to wear because it prevents you from any sort of accident, any injuries, and it promotes this, working environment that, everyone is following the same regulations, the guidance. You need to make sure there's a healthy and safe workplace for the workers, make sure that you have a strong health and safety record in place as well, and preventing accidents. They can reduce significant amounts of work days. In essence, health and safety is not merely a regulatory burden, but a strategic investment that you have to do for your workers. 2D1, there are many consequences of non-compliance, and we looked at that a little bit earlier as well. Non-compliance with health and safety can have a range of serious consequences, financial penalties, legal repercussions, even loss of life. These consequences would have a significant impact on individuals and organizations. So it's really, really important to have health and safety in place. In your organizations, anyone, do you have the health and safety policies in place? Have you experienced or seen any sort of actions that that people haven't complied with health and safety? Any sort of examples, anyone? Do people always comply in your organization with the health and safety requirements? Catherine?
Yes, people always do.
Yeah. Have you ever seen any accidents occur where, Catherine, anything that people didn't comply with that?
Yeah, there was a day. Normally you're not supposed to discuss about
Yeah,
uh, a young person to
yeah,
another young person. There's supposed to
yeah,
be boundaries. You
yeah,
understand? So there was a staff that discussed, there was a discussion, and she said something about the young person to another service
yes,
user, and then it
yeah,
went to the ears of the authorities, and they were really
yes.
offended about it. I think she was sacked. Yeah, for that.
Yeah. So it is there are consequences of that, did they get dismissed?
Yeah, she was dismissed because she
Yeah.
wasn't supposed to do that.
Yeah.
The other young person felt she was being cheated and wasn't treated fairly.
Yeah.
So
Yeah, so
it
there
brought a
are
lot of
consequences of
misunderstanding.
these things, there are prosecutions, fines for breaches of these. So regulatory bodies like the HSE can impose substantial fines for breaches of health and safety regulations with penalties potentially reaching unlimited amounts in serious cases. And it could be imprisonment or it could be legal costs. So non-compliance can lead to legal battles, which cost so much. It could be increased insurance premiums, um, you know, or in some cases, it could be disqualification as well. If you do not comply with the, laws, and you don't comply with the health and safety, they are dependent on the severity of the incident, the health and safety, you could be sentenced up to 6 months, and up to 2 years in the Crown Court. So, it's not something that, is taken lightly because, if you don't comply with it, there are elements of, that you haven't followed the law and you haven't taken account of what you should have done. And, you can be sentenced for that. And the fines are not, you don't have minimal fines. They can be um, legal fines that you have to pay as an organization or imprisonment or fines. So, that's why it's really important to comply with what the law expects you to comply with. The next one is looking at the loss of reputation, as we said, or loss of current or potential staff. It might be downtime and loss of productivity. So these are elements of things that may happen, which is quite important that you comply with the legislation that is put in place for you. The health and safety 2D1 assess the implications of failure complying with the legislation or guidance. We have the health and safety executive, and this is a British public body who's responsible for regulating and enforcing workplace health and safety. Their primary goal is to prevent workplace deaths, injuries, and illnesses, and to promote safer working practices. They achieve this through various means like providing guidance and advice and conducting influencing work, conducting research, research on areas that they think that there might be a need to improve. It could be you work in an organization and, the whole point of that organization is that you have put improvements in place because that organization's not working well. So you need to make sure, as an organization, that you are following the legislation. So some of the activities that the health and safety executive do is that they provide advice and guidance and information, training materials. They advise help employers and employees understand, and manage workplace risks. They influence and engage workplaces, so they work with businesses and organizations. So they have quite a big role to raise any sort of awareness of health and safety issues. They conduct research, they identify potential hazards and new approaches to preventing any sort of accidents occurring and illnesses. And they enforce health and safety laws. So they have the power to inspect, investigate, and they have the power if anyone is they'll take enforcement action against any organization or anyone who is not following the health and safety regulations. They also promote public assurance, so they ensure that people feel safe where they work and their environment, and they operate permission and licensing activities. So they're responsible for permitting and licensing to ensure that this safe operation. So they have quite a wide range of powers, and they are there to really prevent any sort of death, injury, or ill health. And help people manage any sort of risk. So they do help organizations as well. So assess the implications of failure to comply. The next one is improvement notices. So improvement notices give the chance to correct what you're doing. So in health and safety, they provide an improvement notice. And Section 21 of the Health and Safety Working Act states that where an inspector is one of that opinion that a person is contravening one or more of the relevant statutory provisions, they are likely to get an improvement notice. And an improvement notice can be issued to require a duty to the holder to do something which is not attainable. And, for example, a notice might require a duty to provide by a given day a guard on a dangerous part of a machinery, but it cannot require the person to maintain the guard in good condition. So these notices are issued so that they are followed as well, making sure that they are, followed, and making sure that the improvement notice is where they just ask you to improve things. And then, if you don't improve it, then, the next step would be like a prohibition notice. A prohibition notice, it means that you stop the activity to which it refers at once. Prohibition notices usually refer to a breach of health and safety legislation. And inspector, again, the HSE inspector issues a prohibition notice if the activities involve a risk of serious personal injury. Do you think it's really important to have all this in place in regards to health and safety? So do you think the HSE, the Health and Safety Executive, plays a big part in an organisation's health and safety?
Yes.
Yeah. Do you think it's a good thing that we've got this in place?
Yes.
Why do you think it's a good thing? It is a good thing, I agree with you, but why do you think it's a good thing to have this in place?
Because they promote public assurance.
Yes. So that the people follow it as well, don't they?
I think.
Yeah, so that people, if a prohibition notice is given on an improvement notice, it makes sure that people are following the laws. And, it identifies that, people will, if there are consequences if they don't follow the law. And these are prohibition notice are served on a person if she or he is of the opinion that an activity by or under the control of the person is a risk of personal injury, and that's under Section 22. And this is, an opinion of the, person who has control over that. So it has to be followed by the person. And if a prohibition notice is issued, then the organisation must have a thorough risk assessment to make sure that everything is in place. If they don't have it in place, then, they can be shut down. The next one is the effects of non-compliance. So there are a lot of effects of non-compliance. If you don't comply with something, it can result, as we mentioned, in severe consequences for a business, or it could be for the staff as well. It could be staff need to be regulated all the time, trained all the time and conducted to show that they understand the health and safety regulations, and there are, potential action by the HSE if they don't follow them regulation, things like legal costs, fine, in some cases, like we said, imprisonment. If you don't comply with them, you could be paying huge legal costs to comply with these things. So it's really, really important that that the health and safety organization comply with everything properly and make sure that workers are complying with everything, but organizations also putting policies in place because, if you don't comply with them, it could make it difficult for the organization. And also it could have an impact on individuals. It could be, there may be injuries that occur if someone's not followed something properly, or it may be long-term health issues or any fatalities. This, if not followed properly, these are the things that it could affect someone psychologically. It could be loss of earnings. So compliance with health and safety legislation is not just a legal requirement, but also a moral and ethical imperative that protects employees, the public, and itself. The potential consequences of non-compliance are far-reaching and can be devastating impacts on individuals. So if you don't follow anything within your organization, it could have a huge impact on you as an individual. It could have an impact on your health, your psychological well-being. So it's really, really important you follow the health and safety regulations, and your employees implement policies, guidance, legislation, that needs to be implemented and put in place. So we've finished learning outcome 2 now. So we looked at elements in learning outcome 2 of the element of looking at the different status of legislation, regulation and guidance. We also looked at things like the GMC and GQC, and clinical bodies like the National Institute for Health and Social Care Excellence, and what their source of guidance is. We looked at the element of looking at the different acts and legislation like the Care Act 2014, the Human Rights Act, the Equality Act, and what role they played within this. We also looked at elements of the regulations in regards to the World Health Organization and how that works with health services and why that is important. We looked at the elements of the impact and provision on workers with health and social care, and looked at health and safety and the quality of the provisions. We looked at the element of the purpose of legislation. We looked at analysing in 2M1, analysing the aims and purpose of legislation. We looked at Department of Health's purpose. We also looked at the main purpose of legislation and guidance as well, why it was so important. We also looked at the implications of failure to comply, and why health and safety compliance is so important within an organisation. So we looked at things like, the health and safety executive. We looked at improvement notices, why they are issued, and prohibition notices and the importance of issuing them for an organisation. And we looked at the effects of non-compliance, things like fines. It could be, the issue of prosecution. It could be a sentence, depending on the severity of the, the offence or the health and safety issue that's happened, because, some can be really severe and some can be very minor, and it depends on what the organisation has done or, kind of implemented. So we've finished learning outcome 2 now. These are some of the health and safety references that we've used. Health Standards Framework English, Wales.nhs. You can just right click and open them and have a read of them. And Perspective Consistency, Continuity and Coordination, and that looks at patient care. And we've looked at them in detail, so you can right click them and have a look at them. We've finished learning outcome 2 now. Has anyone got any questions? This is all recorded and it's all a Moodle for you. So the learning outcome we did yesterday, learning outcome 1 is on Moodle, and learning outcome 2, which is today's session, will be on Moodle for you recorded. Has anyone got any questions before we finish the session?
Yes.
Yeah.
I just want to ask, it's not in relation to what we have done today.
Yeah.
It's just a general question. If you notice, I am not so consistent in my classes because I work at weekends. Does my attendance affect anything?
I think that they expect you to, I think you have to email learnerwork@ukvarsity.co.uk. But I think they do expect you to attend. But if your attendance is, if you can't, then what you do, you just listen to your recorded sessions, which are on Moodle.
Yeah, I always go back to it to
Yeah,
but
that's good if you go back to it and you're getting on with your assignments. I think it's
yes,
really important you attend because I think assignment discussion session, we've got that next week as well. So we've got learning outcome 3, and I think it's assignment discussion session is where you need to work together as a group and ask me questions around the assignment. But I will go through it in a lot of detail with you so you've got an understanding of what you're doing. But I think attending that session will be kind of an overview of all of it. I tend to go through all the learning outcomes and then briefly, very briefly, because you've got full recordings of them. And then we go through the assignment discussion. So it gives you a bit of more detail to talk around what is expected of you in the assignment. So try to attend what you can. If you can't, email learnerwork@ukvarsity.co.uk. Okay?
okay, I'll do
Yeah.
that.
And the recordings are all on Moodle for you. Will be on
Yeah.
tomorrow. So you've only got another learning outcome to do next week, learning outcome 3, and then the assignment discussion. Does
Mm.
anyone else have any other questions? Anyone? Deborah, Catherine?
No.
No, you all okay?
Yes.
Okay, so the next session is learning outcome 3, which will be looking at understanding the principles and values that underpin the provision of care. So thank you for attending today's session, and I will see you all next week in next week's session. Lovely teaching you, and I will see you, and all of you have a nice week. Thank you for attending today's session.
All right.
Thank
You're
you.
welcome.
Thank you. Have a nice week, everyone.
All
Thank
right.
you.
Take
Bye.
care. Bye.